Hey friends, Dr. Christy here, and I had some conversations with some people today, and I wanted to share something with you guys too, specifically around blood work and what your insurance covers and going for your annual physicals and things of that nature. So when you go to your regular doctor for your annual physical, congratulations, your insurance pays for it, usually 100%. They even allow you to get blood work done once a year across the board. And so then they give you that clean bill of health check. You've checked a box off of what you need to do for your health for that year. They tell you everything is normal and everything is fine. Go ahead and go on your way. However, notoriously speaking, regular medical doctors, when they're just doing an annual physical and annual screening, they don't check for everything under the sun, because why should they, quite frankly, especially if you're not coming in with any particular complaints. They do the bare minimum for basic physical. The problem is the bare minimum doesn't pick up problems when they're not apparent. Things will only become apparent on your blood work when they're really bad, quite frankly. If they're bad on your basic CBC and your basic comprehensive metabolic profile, then you know that you have a serious pathology that needs attention now. And congratulations, if those things all come back clear, even if a few things are a little bit out of the ranges, most of the time Western doctors will look at that and go, yeah, this is not a concern. You're just a little bit out of the range. However, once again, if we're looking at optimal ranges, if we're looking at making sure you're not overinflamed, and just having other suboptimal issues that are causing maybe just slight fatigue or headaches or difficulty sleeping or hormonal imbalances, you name it, if these things are not a huge issue, they will not be caught on routine blood work. So I encourage you, talk to your doctors, get educated. I often recommend when I have my patients get blood work, I recommend that they get all the basic things, of course. So we're looking at your lipid panel. So we check your cholesterol in all the different areas. We check that comprehensive metabolic profile. We check your CBC with a differential so I can see what the percentages look like across the board, what types of white blood cells are most active in your body at this time. And then we check your blood sugar, your A1C, sometimes fasting insulin, full thyroid panel like I've talked before, different hormones to check your testosterone levels if you're a male and female, quite frankly, estrogen, progesterone if it's necessary for a female, and cortisol on almost everyone, because I need to see at what point you're at with regard to your adrenal and stress response. And then not to mention maybe an ANA to check if your immune system is overactive and attacking itself in some capacity, your iron, your B12, your folate, your vitamin D levels, and then even things less well known like HSCRP and homocysteine levels to see how inflamed you are. These things are not always regularly checked, and they can be so profoundly important to get the big picture of your health and what you're doing with your body overall. So just my quick tips for you today. If you're going in for an annual physical, consider adding those things, talking to your doctor, and see if they'll check those things once a year to give a broader, more real, comprehensive picture of you and your health. That's all I have to say today. If you got more questions, drop them below, and I'll talk to you soon.